Hi guys, I'm just going to run you through the importance of what we need to be doing after the patient's fifth session. Now by that I mean the session where they've run through their free intro, they've done the assessment, and they've done 3 rehab consults where we've been quite close at looking at their technique and making sure that they're working correctly on each device. Now at this point we look to get patients to invest in a package of 9 sessions or 12 sessions. Typically 9 sessions will get them to their next reassessment point. So that's the one we go for initially. Now, because we do get, or we have seen in the statistics that some patients are dropping off after this 5th session, we've decided to try and incorporate a little bit more education at the end of this session and try and get the patient to really understand the need to continue. So what I've got here is just a few dot points that should help with that. So highlighting the importance of deep muscle activation and continuing the process of maintaining the work for the deep muscle now that we have started to reactivate them through controlled activation techniques on the devices. So obviously reiterating the point that deep muscle still needs to continue to work, even though we've done some work to it already. Discussing the reconditioning cycle and progressing into the improved motor control phase. So obviously going through that early phase of controlled activation and progressing now into that improved motor control phase where we are now getting those deep muscles to start to work better and start to work better in conjunction with the larger muscle. Providing a greater understanding of self-management strategies for reducing pain and stiffness, as well as any ongoing need for manual therapy to continue, reducing tightness and stiffness and allowing better movement on devices. So if by this point we've still got someone working with, one of the physios or massage therapists to make sure that they're still getting that ongoing hands-on treatment to release the muscle tension and any other associated issues going on, we need to reiterate the importance of that, as well as self-management strategies, things like stretching or using massage balls or basically, using heat packs and things like that to make sure we're keeping their symptoms under control while we're trying to work these deep muscles. If they're ready at this point, obviously from a deep muscle control and pain management perspective, as we said, if someone's in quite a bit of pain and we're working them quite closely and not trying to elicit much of a response in larger muscle, then, if they're still getting a little bit of pain after sessions or through the day, we may hold off on their home program. But if they're ready, we'll start to incorporate some specific and tailored home exercises and stretches. So we can do that through PhysiTrack to assist with their progress. Reiterating the need for us to see their midway assessment results. So after 12 program sessions, we'll redo their assessment, and that's our best way to determine how they're actually tracking, because we can then see the data, see how they've actually produced their force and their results in their reassessment, and we can see how their spinal muscle is actually responding to the treatment. And, we will get most patients to understand the need for continued progress on the devices at this point, but always reiterating the need for movement to feel good. So basically, as long as they know that movement always needs to feel good, then they know that we're actually, really caring about their response, really trying to understand them, their body, and the best way to move them. So, these are some of the key points that I think if we can cover these without, giving extra handouts and things like that, if we can cover these areas, then we're going to continue to get buy-in from patients and clients into the next phase of the rehab program. Excellent.